present our next speaker. So we have a subject with the title Thinking Function in Aligner Therapy, a TMJ-based approach towards a new concept in functional orthodontics. Please welcome Dr. Yong-Min Jo. Welcome. Welcome. Cheers.
Yes. Yeah, but the topic of today is TMJ. Does aligner treatment affect the TMJ, or how? And I know what you're all going to say. No. So, but I wanted to show you this article which asks, is ortho responsible for TMD? And you know, interestingly, orthodontists say no. 75% say no, we're not responsible. There's another question, is orthodontics the best option to treat TMD? And in that case, orthodontists also say no, it's not the best option. So to sum up, we orthodontists believe that orthodontics does not cause TMD. They also believe that ortho cannot fix TMD. So we're in a crossroads. So just to demonstrate, you know, if you have distalization processes, I think there are some effects on the bite and on the TMJ. You know, there can be bite openings, bite shifts, or you have bite jumps. You know, if you have class 2 elastics in the simulation, it looks really perfect, but I think there's a shift in the mandible, possibly. And I think orthodontic treatment that changes the bite has an effect on the TMJ position. You know, there's an article which examines that, and it states if there's an occlusal change, it has interactions with the TMJ situation. So it's interfering. Changes in occlusion can affect the TMJ. But we all believe, and I think that's also a legitimate assumption, the TMJ can adapt to changes without causing TMD. And as you see here, the masticatory system has a high adaptability to occlusal changes. And the joint can adapt. And yesterday, we also heard it can remodel. And I think adaptation is possible. Therefore, aligner therapy is generally safe. That's what we can assume. But we have to be careful of overloads, too large, too fast. I think there are 3 stages to adaptation, if you look at that. And exceeding a certain value can initiate problems. So if you look at this article, which examines exceeding the limits of adaptation. And the TMJ has limits, and overloading can indeed cause problems. And we have to respect the boundaries as orthodontics. And yeah, this is just a short illustration and just a mind-thinking process where we assume that we have a stage 0. That's a stable situation. And please don't use that anatomically. It's just a reference for the adaptations. So stage 0, for instance, safe, stable. You have a capacity to adapt. And then you have influences that can lead to compensation. So you have an adaptation under strain. And at some point, you will get into incapacity, overload, or symptoms. And if you look at the range, you know, stage 0, stable situation, strains or adaptation factors can be pre-factors. There can be factors that you had before. Or they can be induced during orthodontic treatment, or you finished your case and after orthodontic treatment. Overloads. And let's see, in orthodontic patients, you know, pre-treatment, before you start, you could have 3 different situations. You can have stage 0, is a fully not adapted patient, and during treatment, there can be factors that lead to adaptation, or there can be bigger factors that lead to exceeded adaptations, and that can cause no symptoms or symptoms.